Good morning. This is Dr. Meridian Mangano going over the Gift of Healing Hands, Chapter 4, which is Acupuncture and Becoming a Healer. I'm very excited to talk about this chapter. This has just built up steam and is really getting to some of the heart of my philosophy. And as I'm rereading this, I can just see how just the excitement is building and the understanding is washing over how I view people, how I view my role in their interactions. So I'm really excited to discuss TCM, or traditional Chinese medicine. In this chapter, I describe my exposure to acupuncture and the world of Meridian therapy, which we'll discuss in a little bit. It really came from a sports background. I, at the time, thought I was going to stay practicing as a chiropractor in either Kansas City, so that would be Missouri, or Kansas side, and to do so, to practice something called dry needling, which is a needling technique that's become really popular in a sports chiropractic realm and a rehab realm. The dry aspect of dry needling just means as we're using a needle to work on your muscles or a site of pain, we're not injecting anything. It's dry. So the needle is really tiny. To an outsider, it would look like acupuncture. So as a student, I thought, all right, I need to get this 100 hours of acupuncture out of the way so I can be able to practice dry needling, which is what I wanted to do. It was a decision to take this course. It was outside of chiropractic school. Nobody in my direct group of friends was doing it with me, and so it was really hard to dedicate very long weekends sitting in the basement of a chiropractic office with a lot of older doctors coming in and trying to get continuing education credits, and I was not interested. I felt like everybody who was getting up there explaining their beautiful experiences with acupuncture just was biased or not the kind of chiropractor that I come from and my mentorship. So it was really hard-headed for really most of this program. So while, yes, I was learning it, I was memorizing like most students do in a medical field. It wasn't really until I had my own personal experience with the treatment of acupuncture that something got intrigued. I was like, okay, what just happened to my body? I don't understand what you just did, and I'm pretty knowledgeable about healing and changing pain. And so that really opened my eyes to having to humbly accept that there was so much that I did not know going on within the human experience. So this chapter really walks you through the introduction to, I think, the moment we all have that aha, like epiphany, like, whoo, I don't know what just happened, kind of felt like magic a little bit. Even my provider may not have all the answers as to why it happened, but I had pain, I had this experience, now I don't have pain, and I feel something inside of me, maybe not always in the direction of the local area that's being worked on, but something just happened. And once it's tangible, once you have that epiphany, you can't go back. So in a general explanation, I find myself saying this almost 3 times a day to a patient. Acupuncture, the philosophy of acupuncture in traditional Chinese medicine, is an accumulation of many modalities of healing. Herb medicine, old traditional bone setting, which was the Chinese version of adjusting joints, cupping, not modern suction cupping, but old glass and a flame version of cupping, and then this needling technique, the acupuncture portion. So all of these collective groups put together is really a branch. These different branches are put together to offer the energetic body a chance at homeostasis. In a Western culture, we're like, what does that mean? In Eastern culture, it is very understood, it's just the norm you learn from childhood that you are very energetic. Everything around you is alive and energetic, and we all have this internal environment coexisting and interacting with external environments. So in layman's terms, how I describe it is acupuncture is, they believe your body is a huge accumulation of memories, emotions, and this electric circuit in our nervous system and along our skin can be stimulated it can be disconnected just from some traumas in daily life. And so the Art of Acupuncture is looking for these little tiny points along your skin, something like 360 points along your body, that they believe can target, reboot, reset, recommunicate this flowing energetic system within you, also known as Qi. And any Eastern philosophy that you are introduced to. In this book later, we'll talk about yoga philosophy. Their version of that life force, that internal, subtle life force under the body that just can't really be anatomically dissected, it can't be touched. Their version is prana. So yoga has prana, acupuncture has chi. Everybody's trying to describe to you that there is something inside your body beyond muscles, bones, and joints. And I don't mean hormones chemically rolling through your bloodstream. So it was really challenging to accept this system in the beginning because acupuncture heavily uses organ charts, meaning you'll see this stargram in the book that looks, for some people, especially when I practiced in Oklahoma in the Bible Belt, kind of looked a little daunting, and they were like, what type of black magic is this chart? And I had to describe that the star was the interconnecting relationship between organs. So how the kidney and the bladder associated and worked with the heart and, in the circulation, and then not just in chemical ways, but in emotional ways. The energetic emotional health of your heart can influence what's happening in your lungs and your large intestine. So for quick access, this chart is really interesting to look at how interconnected our body's systems are. And then if you look at it in an energetic way, understand how emotions communicate all through the body. And if not worked on, if not addressed, how that emotional or energetic electric imbalance can then eventually lead to the lack of function of an organ, the hyperregulation of an organ. And so that dis-ease, that dysfunction could eventually become actually something chemically wrong with that organ. So when I was writing this book, I practiced in Oklahoma, Tulsa, Oklahoma, and it was within my scope of practice as a chiropractor to utilize acupuncture within my chiropractic treating and things like that. So, I had to be cautious. I couldn't say, hey, energetically, I'm feeling, what you're describing. I think something's going on with your left kidney. I have to be careful of my scope of practice. As a diagnostic physician, there's always that fine line between intuition and science. So it was really wonderful to have both languages, see out of both eyes, but have to come back reality and stay within my box. So I'm not making claims outside what's safe and what's comfortable for people. So this chapter is really interesting because it discusses learning where that barrier was, discusses how not everybody is prepared to have the conversation of depth, that there's something going on within you that is electric, that is subtle, and that is trying to talk to you. The subconscious body, we talked about in earlier chapters, is that underlying portion that's always running. It's your heartbeat, it's your lung rate, and it's trying to communicate to the surface, to that conscious awareness and perception that, hey, I see something's off. This must be what you're trying to tell me. That's where that disconnect comes from. So we can feel physical pain, we can feel physical sensation, but it's hard then to understand and translate what is the required action. So I believe that acupuncture is one of those wonderful portals into understanding that you have the power to communicate with that subconscious part of your body, and vice versa, that it is trying to talk to you. So now that I'm not in Oklahoma anymore, I practice in my hometown of New Jersey. I'm not allowed to be a chiropractic acupuncturist anymore, but acupuncture is a part of my language, my lifestyle. I just use the emotional component of it. I use the energetic component still to this day without the actual, needling portion, which is where the scope limitation lies. And I think this is important, even regardless of, where you're practicing. It's just a different way to look at somebody. So I go see an acupuncturist, and sometimes I feel almost like that, oh my gosh, the young version of it is poser, but the imposter syndrome of when I go see a true fully trained acupuncturist to say, oh, I have acupuncture training. It's 100 hours versus an entire school program is so different. And while I find comfort in knowing that I've been exposed to acupuncture and the language, I know that there is a huge separation in how I view the energetic system of Qi and meridians, and someone who that is all they do all day. So highly recommend going to work with an acupuncturist. And then, in my own realm, while I am saying I'm a little, hesitant to talk to acupuncturists because of that separation in our niche, I find comfort in that I love it. I love that I have access now to speaking to somebody through a different language. And what I mean by that is when I look at the body, yes, I'm running through muscles and bones and joints for chiropractic's sake, neurology and muscle motor wiring. But I always have this ear for signs of acupuncture. Meaning, I wake up every night at 3 a.m. Okay, still working on my muscles, still adjusting, but I take note of that. And then I have people say things like, as soon as, I hold a lot of heaviness in my chest, and when I go to address it, when you're working on me and my collarbone, something weird is happening in my foot. So as soon as I hear those signs of widespread responses to physical touch, physical pain, I know there's an energetic component, there's an emotional electric component. And in acupuncture, they believe your body fires at different hours of the day. It allows, almost like an organ system is most active at a certain time of day. Kind of metabolically, but mostly energetic and emotionally. So throughout the night, if you are struggling between 2 to 4 a.m., that's usually significant of there's an imbalance, there's distress within your lung meridian. And when I describe this to people, I think they're like, oh my gosh, what's wrong with my lungs, especially right now during a pandemic. And I have to really be careful of, hey, this does not mean physiologically you need to go and have your lungs checked. This means that the common emotions that we find dictated by the lung organs, the lung meridian, is pertaining to the stress that you're going through in your life. So the liver meridian, for example, so all of these meridians, there's these lines of energy going through your body, flowing Qi, and that is what people acupuncture. They needle along these lines to either stimulate them, calm them down, reboot them. Most of the 12 main meridians that people use are named after an organ. And so learning that system, I was like, does this mean it's organ pain coming up the line? Is it a referral pain? So it was really hard to compartmentalize the science brain and the energy brain. And I just describe it as they believe that through this acupuncture system that an organ can house a certain pattern of emotions. It can be affected, and it can almost create the home base for a group of emotions. So using a chart from, if you've been exposed to the Emotion Code, Emotion Code is a book by Bradley Nelson, and it has 2 columns of kind of derogatory emotions, and then the rows show you which organ houses that emotion. So it gives the provider, the energetic provider, something to work off of, saying, hey, you've been struggling with bitterness, anger, regret. We find that most people having an issue with these emotions that have not been processed or they're suppressed usually struggle in the liver and the gallbladder area. So while yes, I need you to go see your provider to make sure physiologically those organs are safe, let's have the conversation in here of how that can be coming to the surface and your body trying to talk to you about who needs to help you resolve these emotions and how is a better, healthier way to express them so they're not just sitting in your body, in the organ, vibrating negatively with all the cells around that area, which eventually comes out as physiological changes and alterations. So for someone who's not been exposed to acupuncture, this is a lot. This is a lot to take in, and that's why I introduce it in pieces while I'm working with new patients. Probably the first day, something is just as simple as, hey, yeah, acupuncturists believe that your body is a whole electric system. And they're like, okay, I can see that. that would be it for the day. And then maybe, depending on how open or curious that person is, we would go into it more after I see them again. But the joy of writing a full chapter based on one of my favorite philosophies is I go all in. And I definitely reference some of my wonderful mentors and the beautiful program that I did take for the 100 hours. The late and wonderful Dr. Richard Yenny is the program that I studied under, and there's a list of 6 ways to become a more evolved healer. And so I'm not going to go through them in this video, but I do want to just read them to you, and if it sits with you in your own realm of maybe a parent or whatever you do as a career, energy healing, yoga teacher, I think we're healers in all of our specific niches and our specific outlets during the day. So while you may not have a patient to work on every 30 minutes on a table, remember that you can still be a healer in your own life, in your interactions with your family, or just the people you pass throughout the day, with your plants in your house, with your pets. So these are the Chinese medicine recommended steps to becoming a more evolved healer. Number 1 is to improve your connectedness, to recognize and acknowledge your connectedness. Number 2 is a transformation process. Any Eastern philosophy that takes you from a physical foundation to an ascension process towards some type of spiritual awakening, there's always going to be a transformation process that may include both physical, mental, emotional, spiritual, all of the above. Number 3 is removing blockages to healing. And I really love talking about this portion in the book because I believe that is the number 1 thing that I do in my office. As an intuitive healthcare provider, as an alternative healthcare provider, I'm not fixing you. I am getting the resistances and blockages to healing back into alignment, back into ease, so your body can come through and do its natural job of healing itself. Number 4 is content with detachment. Content with detachment. That was a little harder to describe without seeing the conversation beneath it, but there is an interesting detachment that has to go on when you're working with energy medicine, intuitive medicine. Our own human mind on the receiving end of witnessing someone going through pain, hearing somebody's pain, is constantly trying to relate to them, put yourself in those shoes. Your brain doesn't like seeing pain, doesn't like the feeling, the memory that you could be in that pain, and puts up a lot of blockages. So there's this compartmentalization that happens as a healer. Also something called compassion fatigue. You are just bombarded with people's pain all day, and something I've worked on with a lot of providers in my own brief career is secondary Ptsd, not realizing that you are getting kind of overstimulated and hearing so many bad things that your threshold becomes very high for being affected. And so there's almost this numb, frozen aspect of being a caretaker that if you're not careful, if you're not conscious of it, can really go home with you and affect your ability to be open in your own relationships. So when I hear content with detachment, I hear all of these ideas of separation and compartmentalization. Number 5 is to be able to have a future vision. So improving your ability to look into the future helps you to become a more evolved healer. And number 6 is gratitude and surrender. If nothing else, a theme of this book has been my gratitude and surrender. Gratitude for the amazing patients that have helped learn with me and let me learn on them, with them. Just some of the beautiful mentors that I've had, and truly surrendering to, okay, there's something going on in these patients' life that is not muscles, bones, and nerves. There's really something trying to speak to me, and if I allow myself, I can understand it, I can answer it. And so surrendering to the call of being a more intuitive healer, and surrendering to the call of then sharing that message and speaking to the masses, and writing a book about my belief system and how important I think it is to become normal best care. So I really hope that you enjoy this chapter as much as I have enjoyed writing it. and reading it. And please let me know if you have any questions. I look forward to our next conversation. Have a great day.